Face and Body family. So
we
today,
match.
yay!
See?
And we didn't get dressed together.
Yeah. I'm still
I
in
need a
scrubs.
pair of these bad boys.
So I actually just did a facelift this morning.
Oh, you did?
Yeah.
So one popular question that we get, it's our 411 Thursday, is after you have a facelift, should you get facial fillers, injectables? Where I'm a firm believer of yes, you should, because what we're doing when we're doing the facelift is nip and tuck, nice and tight, right?
Yeah, so I think the facelift addresses and fixes the foundation. And I first off, the facelift is a little bit of a misnomer because people think, oh, you're pulling the face back. But a facelift really treats more so kind of the lower face, jowls, and the neck. It treats that very, very nicely. One of the most challenging things is addressing the mid-face.
Right.
And that's why I like to then defer to my wife to do the volumization.
Yes. So some patients do come in for their first time consult and they think that, oh, what I'm going to do is I'm going to pull that face nice and tight and I'm going to get all that bone structure back and all of that. And what he's really doing is addressing everything that's falling down, tightening up that loose skin. But then what happens is as we're aging, and I meant to bring in my little diagram thing, but what happens is all the tissue that's here, the fatty pocket, this all starts to fall down here, and that's how we get those jowls. So when Dr. Park goes in and he tightens up the lower face and the neck, then here I will team up with him about 2 to 4 weeks later. We'll add some filler of your choice. I'll go over all the different options that we can choose, and that's where we would bring back the volume to the mid-face, and also we can create some bone structure. We can go along the jawline, and not necessarily does every patient need to have that done after a facelift, but a majority do, right?
I agree 100%. I think, and that's the beauty of us being able to refer back and forth. Once in a while, I will get someone that's very thin and gaunt, and they need volume. Now, there is going to be a question that, could we fat graft? Yes, but sometimes these thin patients don't have any fat to get.
Right.
So again, I mean, I think we both love Voluma, which
Right.
is just such a good product.
Yeah, and it goes patient to patient. I mean, we use a wide range of Galderma and Allergan products, which is Allergan is with Voluma, Juvederm, and then Galderma is the Restylane family. So it really depends patient to patient. Some patients, they've been using Restylane for years and they would just like to stick with that. And we can create anything out of the product that you choose. And we'll meet on that, and I will tell you my professional opinion. Dr. Parker will address you, and we can get a whole, facial setup for you. But yes.
And I love.
Yes.
Yes, and I love Ashlee. What's so good about Ashlee? When you consult with her, she's so artistic and natural. If you follow what she does, that it's so important that both of us listen to each of your individual's goals. For example, with lips, some people like them full, some people
and
like
everybody is so different. That's what I was going to bring up too. Is I'll have some patients that will come in and you'll start seeing some more photos going up of the bone structure of the cheeks. I mean, it's just like the lips. I'll have a patient comes in and she wants it to where nobody will know, but she wants to bring back that youth of her lip because she's getting some lines that are going onto the skin and her lipstick is running. Or even I have male patients where as they're aging, they're starting to get the turn down right on the corners, and we can just do it very youthful. But then we also have patients where they want huge lips, which we don't judge. I mean,
right.
To each his own, and it goes along with the cheeks. Sometimes people want that, nice contour, and some people just want a little bit here or a little bit there, and we can do whatever, and we'll meet together. Yeah. That's great about this.
So we really, really listen to you guys as individuals, and the same thing goes with my facelift. I really, really like to give, I think we both like to give natural results in terms of refreshing and rejuvenation. Mm-hmm. But I have patients, for example, I'm doing 2 on Monday, that want a more drastic look. I wouldn't say Hollywood pulled back that drastic, but some people want a little bit more of an aggressive tightening.
Right.
So we listen to each individual
Right.
Very, very closely.
Right. And don't ever be afraid to ask us. Like, I have some patients where they just don't want to tell me that they want those huge lips because they think that I'm going to judge them in any sort. But everybody's different. We're never going to criticize what you are wanting or whichever. I mean,
Well,
everybody
I have
has
an opinion. I might be like, oh, those are too big, but as long as
But
you
it's
like
what
them,
you want and
Yeah.
what makes you happy.
you.
Thank you for tuning in.
Oh.
That was a
Okay.
whoop.